virtually every aspect of healthcare involves the use of these very precious things, our hands.
As a nurse, my hands are really, every interaction we have with patients is usually with our hands.
They're extremely important. I use my hands a lot in my everyday work, and mostly getting people out of bed and assessing them.
My hands and what I do are very important. I think we all know that we use our hands a lot for all activities, and certainly we examine patients, we touch computers, we shake hands of other staff, and so the hands unfortunately are a very integral part of what we do as doctors and just as human beings.
When people are very frail and sick and their immune system is rather weak, they're very susceptible to these infections, and so if they're brought into the hospital environment, and of course if they're part of the new and growing antibiotic resistant bugs, then that's when the trouble really occurs, and that's why we're really serious about doing something about these healthcare acquired infections.
We know that poor hand hygiene does contribute to the spread of infection. You can see it just from your day-to-day work around the ward. And when you think about going on a ward round, you're potentially seeing 20, 30 different patients, and each one you're going and examining and touching, so potentially your hands are going to be touching 30 different people in just a morning's work.
Yeah, I think hand hygiene should be universal throughout the hospital system. It's a very straightforward way to limit infections, and it's very cost effective, it's very cheap, it's very easy, and for those reasons it should be universal.
I'm sure most patients would expect when they're in the hospital that they would be in a safe environment, and they would expect the nurse to be the patient advocate, and that is our role.
I was riding my horse and unfortunately just dismounted awkwardly and sustained some severe fractures which required me to go to theatre and have fairly extensive orthopaedic surgery, which then became complicated by an in-hospital infection and has made my recovery very complicated and extremely lengthy.
I had an operation called a colostomy, which meant that I had a stoma fitted in my front and my rear end was sewn up.
I had an operation on my leg. I had my vein stripped and ended up with an infection when the bandages were taken off.
After being discharged, within 5 days, a redness was discovered at my rear.
After 4 weeks of oral antibiotics, I was told to go back to work, and I had a strep infection, and went back to work, and after 3 days I kind of fell off my perch a bit. I
had salt baths twice a day, and by the end of that month it was starting to show signs of it slowly healing up. But it went for about a month and a half.
I had to have another operation to cut the infection out, and after being in hospital for 3 weeks with a PICC line and drain bags in my leg and all sorts of nasty things and unable to walk around, I was sent home with a golden staph infection. It
slowed down the healing. I couldn't sit down on an ordinary chair for months afterwards, so it slowed that down. Even sitting in the hot salt bath was agony.
Expect them to have clean hands all the time.
Oh, definitely. Clean hands are a must. I'm going to a healthcare professional, yeah, I'd expect that.
Oh yeah, but I guess you just kind of assume that, I suppose. Like, you wouldn't go in there and ask them, have you washed your hands? You would just kind of assume that they are clean.
It's intimidating being touched by someone else as it is, so you hope that everything's clean and hygienic before they come near you, really.
I've never really thought about hands having bacteria on them or anything. It just doesn't really cross my mind.
I wouldn't feel comfortable asking a doctor or a nurse if they've got clean hands, because I really would say they're professional people, and I'm sure they would do that.
No, I'd expect a healthcare professional to have clean hands. It's part of their job, really.
I think everyone would expect someone who's looking after you and caring for you to be hygienic and clean.
Well, certainly there's very powerful evidence that alcohol-based hand rubs are very effective ways of reducing healthcare-acquired infections. But changing culture is sometimes quite challenging. Many people have been trained with a certain washing technique, and now this new evidence means that they need to modify that and do something else as well. So we need to continually remind people that this is now very best practice.
I think it needs to be a culture within the department or unit of the hospital that everyone just does it routinely.
As a nurse, the most important thing about hand hygiene is just doing it. It's such a simple thing to squirt some alcohol hand rub on your hands, roll it around for 15 to 30 seconds, your hands are clean, and you reduce the risk of giving an infection to your patients.
I think sometimes people don't wash their hands as often as they should, just because if they feel they've only done something minor, like if they haven't done a full procedure or something like that, then they feel like, oh, I don't necessarily need to.
Part of the problem is when you're a resident, you're so busy, you're rushing from one patient to the next, you're trying to do a number of different jobs probably all at once. So sometimes if it can seem something inconvenient to suddenly have to stop and wash your hands.
One myth is that the newer alcohol-based products cause problems. I think this is because people who have pre-existing dermatitis sometimes notice some stinging and burning with the alcohol-based products. In our experience, this isn't an allergy, it's just a low-grade irritation. And once their skin problems settle down, once their dermatitis improves with appropriate treatment, they can then actually use these products quite safely.
I've never had a problem with skin irritation from these hand rubs. They've got a sort of emollient in it, and I found my hands actually quite nice now, much better than they were with, soap and water.
Doctors and nurses and other people in the hospital environment have to pay attention to the basics, and the basics are making sure that you're clean and that you don't pass on any infection to your patients, which can compromise all the wonderful other things that you do as part of your everyday work.
The cost of one hospital-acquired infection, from an emotional and financial point of view, is amazingly significant.
I expect that when we need to see a member of the healthcare profession, that we should be able to put our health in their hands and have a road to recovery as quick and as uncomplicated as possible.
I expect as a patient, if I'm sick, to be cared for in a hospital, not to come out worse.
We're privileged to look after people, and they totally trust us and they put their lives in our hand, and I think that's an absolute privilege to look after people, and I think we need to honour this by looking after them.
There's no excuse ever for not washing your hands. Never. There shouldn't be any excuse whatsoever.
Hand hygiene does save lives, there's no doubt about that.